The government of the Virgin Islands is continuing to demonstrate its commitment and dedication to progress in all areas, including providing the territory with a world-class healthcare system. The Ministry of Health and Social Development is the authority charged to carry out this mandate that also includes safeguarding and promoting the health and social well-being of the people of the Virgin Islands. Minister for Health and Social Development, Honourable Vincent Wheatley, said managing this portfolio since the government took office 6 months ago has been exciting yet challenging as his ministry sought to carry out its mandate, which included management of waste in the Virgin Islands. The ministry is undertaking the management of waste with the implementation of short, mid-term, and long-term action plans. The short-term plan will see the burial of all incoming waste at the incinerator on a daily basis and covering waste with a minimum of 6 inches of compacted soil to help minimize the risk of spontaneous fires. The medium-term plan includes full repairs through the existing incinerator, including procuring and installing a new control panel, which was destroyed in a fire in February of 2022. The final stage of the plan is to implement a ban on single-use plastic containers and incorporate a refund system on glass and aluminum containers.
The biggest issue with waste management, I must say, must be Parkwood Pond. And since bringing on board Mr. Marcus Solomon, he has done a tremendous job of arresting that problem of fires at Parkwood Pond. And we've seen a significant reduction in those fires. And of course, the incinerator. It's been down since February of 2022. I am so happy to report that we are doing 2 things as pertains to the incinerator. First, we're trying to fix the old one. And the first part, there's 4 parts to get it fixed. First part arrived on Sunday and it's being cleared as we speak. And I'm trying to get the update now and when the other 3 parts are going to get there. Once we get all those parts, I get all the remedial work done, then we'll see that old one back in action. But we're not just stopping there. We've also done a RFP to send out for bids to do a waste management, a new incinerator, so to speak. So we have redundancy. So we're not waiting on this old one to break down again, to be here for years again complaining. We're going to have the redundancy that when the old one breaks down, there's a new one there to just pick it up one time.
Minister Wheatley has been holding strategy meetings with ministry officials to address the issues being faced at the dump sites and have visited sites in Parkwood Pond, Anegada, and Jos Van Dyke.
As it pertains to Anegada, one of the things we are going to do is to put a small mobile incinerator there, hopefully by 2024, 2025. But we're bringing a whole new waste management strategy for both Anegada and Virgin Islands. So each of those dump sites have their own peculiarities. So we are addressing them individually, one by one. In Virgin Islands, we're trying to create like an eco park. We sent out for tenders already. The tenders were turned in, I think, last week. They haven't been opened as yet to see exactly who tendered and what the proposals are. But we are addressing the dump sites one at a time.
With its mantra of a cleaner, greener, and more beautiful Virgin Islands, the ministry launched a derelict removal campaign where 347 derelict vehicles were tagged and 271 removed based on information shared by the public. The campaign has been successful and the community continues to partner with the ministry in reporting of sites where these vehicles are located.
So far, we have over maybe 500 cars, derelict cars, that is going to be loaded onto that barge to be shipped out of the country. The barge will come to Tortola first. We're going to get all the cars from Tortola, as much as we can, onto that barge. Then the barge sails to Virgin Islands, where the Virgin Islands set of cars are going to be loaded onto that barge. We're going to try and get the Anegada cars over also. So everything's happening all at once. Then at time, kind of throw us in a tailspin, but those derelict cars are going to be shipped out of here, and then we're starting a whole new derelict car strategy. So you're going to see smaller, more frequent shipments of scrap metal and cars out of the territory.
Honourable Wheatley and his ministry is pleased with the outpouring of support from the VI community with the derelict campaign.
It goes about with the BVI, we are a very beautiful country, and it really irks one person to see after the hurricanes there are still derelict boats and there's still derelict cars and just general untidiness. So persons are happy to assist us to help clean the BVI up. Particularly now that we're going into the tourist season, it's a hard press to get a place cleaned up. You're going to welcome American Airlines, who will put on like 4 flights for some days in the season. We want us to come and see a clean territory, roads fixed and everything. There's a contract being signed to fix the Paraquita Bay to Fat Hawks Bay Road. It's important that our infrastructure is fixed. Water, of course, is on there also. But cleanliness is very important to us. Our environment is all that we have. We have to do all that we can to keep the environment clean. I'm an environmentalist at heart. Cleanliness is very important to me also.
The Ministry of Health and Social Development is carrying out its mandate of building partnerships and relationships with regional and international organizations that would improve the health and social well-being of the people of the Virgin Islands. To this end, the 36th OECS PPS Policy Board meeting and 9th OECS Council of Ministers of Health was held in the Virgin Islands under the chairmanship of Honourable Wheatley. The meeting delved into the pressing healthcare issues facing members of the Organization of Eastern Caribbean States.
One of the things we try to do, there is actually a 2-part meeting. The first part is a pooled procurement, because we buy stuff as a region. So instead of BVI going and sourcing its own stuff by itself and Grenada going, we've all pooled all of us together. We make one order. So economies of scale. So we get the best price possible we can get on pharmaceutical products. What we've decided to do is to expand from pharmaceuticals into dental care and also dialysis. So we're going to see where that's going to help us significantly with the cost of pharmaceuticals. It's already the case where in the BVIs, most of our pharmaceuticals are even cheaper than the US, who's next door. We're going to see prices drop even more. During the pandemic, prices were scaled up, but post-pandemic now, the prices are going to fall by as much as 50% in some areas. So we should see a significant reduction in our pharmaceutical prices going forward in 2024.
As chairman of the council, Honourable Wheatley's theme is that of preventative health care. This theme was adopted by the council as a territory, and the rest of the region tried to contain the number of cases of non-communicable diseases.
It's fine to have the dialysis machines and this machines and that, but what if we could just prevent persons needing these things? So prevention is a significant part of my year as chair, and they have adopted it wholeheartedly because they all agree. If we continue on the way we're going with the cost of healthcare, we'll all be broke in a few years. We have to make our communities healthier and more productive. When you're healthy, you're also more productive.
Honourable Wheatley said NCDs, including diabetes, heart issues, and respiratory issues, are on the rise, that there is a need for lifestyle changes to control the increase in the number of cases, which are also affecting the younger population.
So we're almost in a crisis, or we're heading towards a crisis. So we must have preventative measures. We must watch what we eat. Though we have no control over what is in those packages that we're importing all the time, we have to start being a more educated consumer. We have to be also more proactive to pressure those persons who are bringing stuff to bring in healthier stuff, but at the same time to make it affordable for us.
In 2020, the government of the Virgin Islands introduced the scientifically based Complete Health Improvement Program, CHIP, to mitigate the modifiable risk factors prevalent in the territory among the adult population between the ages of 25 and 64. CHIP was founded in the United States of America in 1988 with proven results in preventing and reversing NCDs and their risk factors. Honourable Wheatley said there is a need for the reintroduction of CHIP and other programs to encourage residents to practice healthier lifestyles.
Now, there are many programs that we've had before. For example, the CHIP program, the Complete Health Improvement Program. A person will encourage to plant in a backyard garden, to plant something of what you consume. We have to get those programs back on stream. Also, the BVI Fit program. We had it years ago. A person do 10,000 steps a day. We got to bring that back. We got the persons moving first of all, and then eating properly. Those are the two key things. And we have programs in place. I think we got a grant recently from UNED BVI to bring the program on stream before this very year is out. Get persons moving and get persons eating healthier foods. Grow something. Tomatoes, lettuce, eggplants, they can all grow here.
The Ministry of Health and Social Development is also ensuring that His Majesty's Prison fulfills the role of contributing to a safer Virgin Islands by providing a safe, secure, humane, and effective prison system with opportunities for rehabilitation, personal development, reintegration, and community engagement to reduce reoffending.
Well, we've done a lot of remedial work at the prison. We have a new van. We've done some work around the prison. We are doing some work in the prison in terms of rehabilitation. One of the things that I really want to do is to focus heavily on rehabilitation and reintegration. And I must thank United BVI for giving us some chess boards and some other games and so forth. Then we're going to start working on the kitchen. They have a wonderful kitchen up there, but it needs a proper home. We are working on that. We're going to train those guys who are interested and girls to bake. Those breads that we can bake, they can be sold or given away to social development, or they can be sold to the public. So we work on as many programs as we can for reintegration. And of course, trying to make the prison even more comfortable, because we cannot deny people their human rights in terms of not having a proper place in prison. As we seek, as you know, the prison is a challenge of occupancy of the prison. I think it's a bit overcrowded. We have to feverishly work on expanding that prison. I don't think we have a choice. Sooner or later, we have to do it. I've been talking to the UK and talking to everyone. Can you help us please find financing, find design, whatever we can do to expand our prisons. So persons, they have enough personal space to function there.
The Housing Recovery Assistance Program was implemented by the government of the Virgin Islands following the devastation caused during the passage of Hurricane Irma in 2017. So far, more than 25 homes have been built and over 200 repaired. This cycle of the program is about to end, but will be refreshed by the government as it seeks to provide more homes for residents who are affected by the hurricanes.
We have done hundreds of homes and as well as repairs. We're now down, currently we just finished 3 since taking office. 3 have been completed and handed over. We currently have 3 under construction to be finished between next month and December. Hopefully all those 3 are there. There are a few more that are to be built, but the money is pretty much at the end of its life. They probably have $1 million left. I've spoken to the Premier, he's fully on board. Because we see the need for housing, we're going to start a fresh new program. We're going to revise, based on the experience we've seen with the one we have now, we're going to bring a fresh new program because there's a significant need in this country for affordable housing. We know how to do it, and we're going to make that a reality very, very soon.
The Ministry of Health is conducting a review of the territory's social policy to ensure that people who are in need receive the necessary assistance. Honourable Wheatley also commended Gender Affairs Coordinator Ms. Patricia Hackett on the tremendous work to update the gender affairs policy while introducing gender focal points in each ministry. There has been significant strides in healthcare in the territory. The Dr. D. Orlando Smith Hospital recently secured reaccreditation for another 3 years. Honourable Wheatley, while outlining further initiatives to be undertaken, said the recent accolade of an accreditation certificate is a culmination of years of relentless efforts by the BVI Health Services Authority's dedicated team.
One of the things that I must report is that there's been significant strides in healthcare in this country. Sometimes the reporting isn't what it should be, but I've seen significant improvements in operating hours, the services, and access, and so forth. So I must thank the HSA for the work they've been doing. I mean, they don't get enough credit sometimes because we want to see the shortcomings of the system. But they've been doing some wonderful things. The accreditation of the hospital, that is significant because it brings significant benefits to the territory. And persons, it catches person's attention. Because I've had several calls since that accreditation. Oh, I see you're accredited now. I'm kind of meeting with you to discuss our medical school, medical tourism, and these various things, or insurance, the impact, or insurance also. So that's a significant milestone. We're looking to build a new senior citizen home on Virgin Islands. They're currently trying to get a plan sorted out. We have the location already. I think the funding is available. We're refurbishing the kitchen currently at a Dina Donovan home. Brand new kitchen, because person need to be eating properly, and have to make sure the facilities are there to accommodate the various diets and healthy eating and so forth. And of course, expanding the services. One of the things that we're going to do as chair of the OECS, Ministers of Health, is to look for centers of excellence where we don't have to be guessing where people are going to go. For example, in St. Vincent, they're one of the best pediatric hospitals anywhere in the region. Where are we guessing what to do with pediatrics? You go to St. Vincent. They're building a big, huge hospital in Martinique. We should be going there in January to look at it, to see how we can benefit from that being in the region. Antigua's taken over the cancer hospital over there. It's going to come on stream, hopefully end of this year into next year. How can we benefit from Antigua being a specialist in cancer? I can go on and on and on about all the things that we have in the pipeline for health. And of course, waste management. We have the strategy currently going through the cabinet process. It's not there yet. We're going to increase our recycling or separation of garbage or upcycling, and also getting waste out of the country. That whatever can be sent away, whether it's metals or plastics or rubbers and so forth, the upcycling, the different grades of plastic, we can turn it to fencing or whatever else it can be used for. So there's a lot of things happening all at once.
Discussions are also being held with the BVI Health Services Authority, the National Health Insurance, and the Pan American Health Organization on several matters, including solutions to ease the difficulties persons face while accessing healthcare outside of the territory.
You cannot divorce HSA from NHI. There are a series of meetings coming up very soon to attack just that problem. I've engaged PAHO, and they said they were going to help us to seriously look at how to make those two systems more efficient. Because one affects the other, and if one fails, the other one fails also. I'm also engaged in the private sector, the third leg of this triangle: HSA, NHI, and the private sector in terms of the service being provided. How do we all work together to make this system work for all of us? There's some significant challenges, and I cannot deny that. But I say we are tackling these, we're taking the bull by the horn. It's a lot to do, but we're taking it head on, and we're going to try our best to get it resolved in the quickest time possible. We have partners in the region, but one of the persons we're trying to engage right now is called, I think it's called a medical finance person. These are persons who specialize in financing medical issues. I think it's probably one or two in the entire region. How do we share these persons? One of the things that, we looked at during that conference is how do we share resources among all the members that we benefit. So I don't need a medical finance person, and Sinkis need one, and Antigua needs one, because they come in and do their job and they leave. But how do we share expertise among the region, that we all benefit from person's expertise? So it's something, again, we're seriously looking at. But NHI, HSA, and the private providers, we're going to bring all of them together and try and figure out this situation we find ourselves in, that it's cause for concern as currently is. I'm not sure it's very sustainable.
Honourable Wheatley, in reflecting on his achievement during the 6 months in office, said his ministry will continue to work to achieve its goal of better and more accessible healthcare in the Virgin Islands.
I don't think my efforts will be realized just yet. There's a lot of groundwork that has to be laid before you see the fruits of the labor. It's kind of like planting a corn tree. You dig a hole, you put a seed down. It's a while before the seed even comes above ground to where you know, oh, something's actually happening. I guess sometimes too we fall down because we don't see the need to tell the small stories, but these small stories put together gives you the big story. Something you want to tell the big story one time, as opposed to just letting persons know the incremental steps you are taking to lead to this bigger picture, which is better healthcare, more accessible healthcare, available 24/7, no matter where you are in the BVI. That's what we are striving to achieve with healthcare in the BVI.